I'm Pamela Brown in Washington. Welcome to our viewers in the United States and around the world. You are in the CNN newsroom on this Saturday evening. And for millions of American families this evening, it is no longer if, but when they will receive their next pandemic stimulus checks. CNN's Jessica Dean is on Capitol Hill. So, Jessica, tell us, what is the timeline if everything goes smoothly from here? When will American families and businesses start to see these payments?
Well, the short answer, Pam, is if everything goes as planned, which it's looking like it will, that it could be as early as this month. That's what President Biden pledged earlier today. So what happens next? Well, this bill is going to go back to the House. They're going to vote on the changes that were made to it. That's happening Tuesday. And then it's going to go to President Biden's desk where he will sign it into law. And quickly after that, they will start to get payments directly to Americans. There's a lot more in this bill as well that I want to walk you through. It's a $1.9 trillion bill. It touches a lot of the American economy. We talked about the $1,400 direct payments. If you're a family that makes $150,000 a year or less, you'll be getting that full amount for each person in your family. If you're a single person that makes $75,000 or less, you will get that payment, that full payment for each person in your family. It phases out at $160,000 for a couple filing jointly and $80,000 for an individual. A lot of numbers here, but these are important numbers to a lot of Americans. It also includes money for unemployment benefits, $300 a week that will extend into September. There's also a child tax credit in here. It's $3,600 for a child under the age of 6 years old, $3,000 for a child over the age of 6 to 18. And what's different about this is that families can elect to get that in a monthly payment spread out over the year. There's also a lot of money in here for small businesses. Here's what President Biden said about the Senate passing this bill a little bit earlier today.
This plan will get checks out the door starting this month to the American people who so desperately need the help. Many of whom are lying in bed at night, staring at the ceiling, wondering, will I lose my job if I haven't already? Will I lose my insurance? Will I lose my home?
Now, Pam, there's also money in here, a lot of money for vaccinations, vaccine distribution, as well as increasing health care coverage for uninsured people, bumping up Medicaid for people in states that haven't expanded it in a lot of ways, as well as money that goes directly to state and local governments. Pam?
All right, Jessica Dean, thank you so much. And as Jessica just mentioned, there was more money in this bill coming for vaccinations because the race to vaccinate America is picking up steam. More than 2 million shots have been given each day for the past week. And new CNN analysis of federal data finds that the U.S. could reach herd immunity by late summer through vaccinations alone. CNN's Paul Verkaman is at an unexpected inoculation location. Paul, tell me more about this intersection of vaccines and theme parks.
That's right, Pam. I'm at Six Flags Magic Mountain right now. This is a vaccine super site. 2,300 people will go through here today and get the vaccination. And because things are moving so well in California, it's anticipated that here in Los Angeles County, they will get into the second most restrictive tier, the red tier, but that will allow them to reopen this theme park at Magic Mountain. Look right over here. Here is just one of the many roller coasters, 19 at this park. And as we talk to people who are getting vaccinated today, we are now seeing those being vaccinated skew much younger, mainly teachers. And when we talked about the possibility of theme parks opening, baseball stadiums opening at restricted levels, even outdoor concerts, they have this sense of optimism. It feels like there's a little bit of optimism here.
Yeah, I'd say so. There's the light at the end of the tunnel.
I still think that people need to be really safe, and I think it's like a little bit soon. I feel like I'm worried about that, but I don't know. If it's okay with the CDC, I'm all right with it.
A lot still needs to be worked out. Officials seem to think that they can coexist here. If Magic Mountain does open on April 1st, it will only be at about a 15% capacity, but we might have a combination roller coaster ride and theme park vaccination site. Pam, back to you.
That's one way to sum it up. All right, Paul, thanks so much for the latest there from Los Angeles. And yes, there is so much promising news about COVID vaccines. There are more of them available and more Americans willing to get them. That is good news. But COVID variants are still a real wild card right now, especially the variant first identified in Brazil, which has now been detected in at least 6 U.S. states. Not only is it more contagious, it has apparently been able to reinfect people who have recovered from other strains of the virus. The governor of Sao Paulo says that his region is on the brink of collapse as the variant threatens to overwhelm the health system. Joining me now is Dr. Lena Wen. She is the former Baltimore Health Commissioner and a CNN medical analyst. Great to have you on, Dr. Wen. First off, how concerned are you that current vaccines won't prove as effective against some of these new coronavirus strains like the Brazil and UK variants and make it harder to achieve herd immunity?
Pamela, it's certainly a possibility, but I would say that overall, I'm very optimistic. And that's because the variant of greatest concern right now to us Americans is the B.1.1.7 variant, the variant first identified in the UK. And that variant is spreading very rapidly here. I mean, it is doubling in every 10 days. It's spreading exponentially. That's not good. However, this variant is one for which the vaccines that we have seem to be extremely effective against. There are these other variants, the variants coming from South Africa and Brazil, the B.1.351 and P1 respectively. They are a bit more concerning. The vaccines that we have may work less well against them, but they still will work very well. And I think it's important for us to keep that in mind, that still vaccination, getting as many people vaccinated as possible and continuing to wear masks in the meantime is going to be our way out of this.
And not to sort of try to get one vaccine over another, right? You would recommend get whatever vaccine is available to you, no matter what.
That's exactly right. These vaccines were not studied head-to-head. So there's no way for anyone to say this one vaccine is better than another vaccine. I could see people saying, I would rather have the one-dose vaccine for Johnson & Johnson, which I'm a participant in that clinical trial. I could see people saying that because it's out of convenience. But there's no way to compare these vaccines head-to-head. And I think people should look at them and say, it's basically a life jacket that's offered to me. I'm not going to turn it down because I don't like the color.
That's a good way to put it. So nearly 30 million Americans are fully vaccinated. That is about 1 in 12 people right now. And yet there's still this question. What do you do when you're fully vaccinated? What can you do? There has been no guidance from the CDC about what these people can and cannot do. It was supposed to be released this week, but the CDC director said it's complex and it will be released soon. You wrote this in a Washington Post op-ed, quote, public health officials have chosen caution over celebration. If this doesn't change, Americans could be dissuaded from being vaccinated, and our country might never achieve the goal of herd immunity. So you worry that the longer people go without this guidance, they're just going to take matters into their own hands about what they should or should not be able to do, right?
That's right. People are already taking matters into their own hands. And some people are making decisions that aren't always the most sound, thinking they can just throw away the mask as soon as they're vaccinated. And on the other hand, I think there are also a lot of people out there who are wondering, what's the point of getting vaccinated? Yes, it may protect me, but if I can't go back to doing anything that I want to do, what's the point? And there is enough evidence at this point for the CDC to be saying, here are the things that you can do safely. And I actually think that there is a real potentially missed opportunity if the CDC doesn't come out and specifically tie vaccination with policy recommendations. There are states that are already opening up. They're already allowing full capacity to come back. Imagine if the CDC said you can have 100% capacity for vaccinated people, but only 25% capacity if you're not checking vaccination status, or saying vaccinated people can travel and they don't need to be tested or to quarantine. But if you're not vaccinated, then you do have to quarantine and get tested. That's the opportunity to encourage people to get vaccinated and to really illustrate to us the freedom that you get from vaccination.
Really quickly, before we let you go, I want to ask you a question that someone had actually tweeted to me, and I thought it was a really good question. When it comes to these different vaccines and the efficacy, there's been a lot of talk about the Johnson & Johnson one overall globally having a 66% efficacy against moderate disease and mild. So what does that mean, though, in practical terms? I mean, does that mean that potentially you could have more symptoms? You could feel more flu-like if you do get COVID? What does that actually mean?
Yeah, I think the important endpoint that we should talk about is the endpoint of severe disease that results in hospitalizations or deaths. And in that regard, the Johnson & Johnson, just like Pfizer and Moderna, prevent 100% of hospitalizations and deaths. So maybe you get mild illness, maybe you get the sniffles, a cough, sore throat, fever, but the key is that you're not going to get so sick that you're hospitalized or die. I mean, that is ultimately what we care about, and why I would highly recommend for everyone to get whatever vaccine is first available to them, recognizing that you can still get a booster shot, you can still get other vaccines in time to come, but for now, get the immune protection to protect yourself and others.
That's an important point. Get what you can now, and you can get something else later, but just get what you can now. Dr. Lena Nguyen, thank you very much for coming on the show and sharing your expertise with us.
Thank you, Pamela.